Postpartum Women's Health, Maintaining Safety and Preventing Complications by Haley Dusseault. Topic issue to be studied. The topic issue I will be working to correct is the miseducation and misunderstanding of maternal deviations and vital signs. If staff are not familiar with typical vital sign ranges, signs, and symptoms, and what changes these values indicate, important indicators of maternal health status can be overlooked. Project's purpose. The goal of my project is to find ways to educate staff who work across the hospital about the importance of maternal vital signs, normal ranges, and what alterations in these values can indicate. This project will work to help these individuals understand the differences in how vital signs are viewed on postpartum units compared to other units in the hospital and other populations. Approximately 80% of pregnancy-related deaths are preventable. Preventing pregnancy-related deaths requires a multi-level approach that includes ensuring quality care for all pregnant and postpartum persons. Mohammed et al., 2023. Hypertensive complications. The rate of hypertensive disorders of pregnancy has been increasing from approximately 500 cases per 10,000 deliveries in 1993 to 1,021 cases per 10,000 deliveries in 2016 to 2017. Henderson et al., 2023. Hypertension is a major complication in postpartum populations that can be identified through vital signs and adequate surveillance. If not treated and assessed, it can result in lifelong complications and be fatal. Hemorrhage. As described by Liu et al., 2017, evidence demonstrates that timely assessment of vital signs can reduce the symptom to intervention period in those who experience postpartum hemorrhage and significantly improve post-intervention outcomes. Hemorrhage is a major complication that can be observed through assessing patient orientation, signs and symptoms, and be fatal if not treated quickly. Statistics. Obstetric hemorrhage, sepsis, and hypertensive disorders of pregnancy account for more than 50% of maternal deaths worldwide. Wilson et al., 2019. Hypertensive disorders of pregnancy affect approximately 10% of pregnancies in the USA and are one of the leading causes of maternal morbidity and mortality and poor perinatal outcomes. Kumar et al., 2022. As indicated by the CDC 2022 and shown by Buckner, 23% of mothers died during pregnancy. 25% of mothers died on day of delivery or within first 7 days after giving birth. 53% of mothers died between 7 days and 1 year after giving birth. While this was in 2022. By properly evaluating these patients' vital signs and ensuring staff are aware of what alterations in vital signs may mean, this can lead to earlier confrontation of these conditions, resulting in more promising health outcomes. Project goal. My goal for my project is I want to implement a training course to educate nursing students and PCTs on maternal health vital sign variations, as well to teach these individuals about signs and symptoms in postpartum populations that can indicate potentially fatal complications such as postpartum hypertension and hemorrhage. I feel this is important to teach as vital signs that may be considered normal on other floors of the hospital can be indicative of serious health conditions and complications of maternal health units. Goal objective. That these individuals will obtain an understanding of the specific ranges of maternal vital signs and which alterations may signify that something may be wrong and when to alert the nurse. By providing a teaching to these individuals as well as a badge rail card for reference with both normal vital sign ranges and signs and symptoms that could indicate adverse effects, I hope to eliminate the occurrence of postpartum complications being overlooked. Outline of project. This project would consist of training sessions and maternal health badge cards that indicate potentially worsening vital signs and symptoms of maternal health patients. The project would teach these individuals about these findings and evaluate their understanding at the end of the training. Timeline. I will conduct this over the course of the next year to provide training sessions, one scheduled each month. Methods of evaluation. An electronic Google form will be provided to participants in the training to fill out after the training to identify what they learned, if they had knowledge of this information previously, and if they feel the training filled a gap in their understanding and knowledge of these populations. IRB approval. This project will require IRB approval in order to be conducted, and so it be a functioning program within the hospital and will be dealing with employees who will be working with patients. Here are some references that were used in the creation of this document. And I just want to take a moment to thank you for watching this video, and if you have any questions, here's my information to contact me regarding more information on this project. Thank you for your time.